and welcome to Gemma's Dog Training Revolution. We are on day 9 of my How to Build the Ultimate Bond with Your Dog series, and today is all about preparing your dog for a visit to the vet. Now, some dogs may have no issues at the vets. They may love having the vets see to them and attend to them and give them a fuss, but some dogs like Chase may really struggle with this. Regardless of where your dog is on the scale of terrified of the vet to absolutely loves them and they instantly become their best friend, today is still really valuable because we are sticking with the theme of trust in this How to Build the Ultimate Bond with Your Dog series. And I think a lot of the procedures and kind of checkups and things that vets do with our dogs, for us to kind of prepare them for that and to perform some of those things at home, still really helps build trust with our dog, and just something different for us to be able to do to help build that trust and communication and bond with them. So even if your dog has no issues at the vet, I still think that these are really valuable things to be able to do with your dog and to build that connection, to just allow them and for them to feel comfortable with you kind of in their intimate areas of ears and eyes and nose, and feeling fine with that. So I'm going to show you what I like to do for Chase. Chase does really struggle with having strangers and the vets come near him, especially when he had an eye infection a couple of years ago. Since then, that kind of really threw him and he become a lot more untrusting at the vets. So I, from then on, started to do a lot of these things at home in preparation for if we ever need a vet to be able to check up on him, or also that I can, if I think something may be wrong with him, that I can give him a good check over myself ahead of having to go to the vets. Now, had I have done all of these things ahead of that checkup for the eye infection, he may have been a lot more comfortable have them doing that. So I always think it's best to err on the side of caution. Maybe you've been super lucky and your dog hasn't needed any vet attention, but it's good to have them very comfortable with certain areas of their body being checked and handled. And if they're not comfortable with having you do it, then they probably won't be comfortable having a stranger or a vet doing it. So here is how I like to prepare Chase for the vet, and this is how I want you to ditch the bowl today. Like I say, no matter where your dog is on that spectrum, I still think it's a really valuable tool and kind of way to build a bond and connection and trust with your dog. So we're going to ditch one of their meals, and it's all going to go for rewarding them for being super comfortable and allowing you to check their body over. And you certainly don't have to be qualified or anything like that. We're not looking for anything medically. We're just getting them familiar and comfortable with having us check certain areas of their body. So what I like to do with Chase is have him sit in front of me. I've just got his food bowl here, and I have some tissue just because he does like to slobber. And I'm going to start by checking his ears. Now, if your dog has never had you check their ears before, and maybe they wouldn't be comfortable with this, then just build up slowly. So the way that I did this initially with Chase is I would just go like this. I wouldn't even check fully. I wouldn't really get very close or look in his ear. To begin with, it was just a case of touch and straight away with the reward. So before he even had time to think, oh, I'm a little bit uncomfortable by that, the reward was already coming. And then what happens is he starts to associate the two. So not only are we desensitizing him to having his ears touched, he's also building an association that when his ear gets touched, something good happens and he gets rewarded with food. And then what I would like to do over time is to just build that up to whereby I can actually have a good look inside of his ear. So that's how I would do that. But like I say, I built that up very slowly with Chase. So if your dog shows any signs of being uncomfortable, then just do a simple touch and just build up over time, maybe 2 seconds. If you have to, if they're really uncomfortable, then maybe have the food. I always prefer to try and do the action and then reward, so that they are understanding that what is happening before the reward. They're not too fixed on the reward. But if your dog really doesn't want you to be near their ear, then the first step, I would say even before what I've shown, is having the food in your hand ready and just a gentle touch, and then reward the food so that it can kind of take away some of that worry by being focused on the food already. And just make sure that they are comfortable with both sides. And we'll have to put the bowl over here so he's looking the right way. I'm just going to have a quick look inside the ear. Good boy. And what I would also recommend is to add a cue word to all of the body parts that you would like to check that maybe he may need to have done at a kind of routine checkup at the vet. So by adding a cue word, then it just becomes like we're performing any one of his tricks. So I may go ears and then just have a look in there. Good boy. And then reward for letting me do so. Okay, so I'm just going to turn him around slightly from the camera. Good boy. Just sit. Good boy. Okay, so I'm just going to show one last time. So we're going to go ears. Good boy. Gentle. Wait. Ears. Good boy. Okay, and then I'm going to go eyes. Nice. Good boy. Gentle. I'm going to do the other one. Eyes. Very nice. Like I say, if your dog has never done this before and isn't fully comfortable, we don't need to be going in fully with these movements to begin with. So for the eyes, it may just be a quick, just put your hands either side to just almost as if you were going to stretch the eye slightly so you could have a look inside, but maybe we don't actually do any like pulling of the skin or opening of the eye there. So it might just be eyes. And just think how you can introduce that kind of movement or action as small as possible to begin with and then build up from there. So I also like to, and this is something that I started doing for Chase's kennel cough vaccine, because obviously for that they have to squirt up his nose, which he absolutely did not want to happen. So for preparation for that, that was really difficult to try and get the aim into his nostril if he was flailing his head around. So what I introduced was a chin command. So I'd have him put his chin, and I would just place my hand underneath like so, and just wait for his weight to drop into my hand. So you'll see he will drop all of his weight, which he has, and then I would just either use a pretend syringe, or for this you could just use your other finger, and just getting him used to having something come towards his nostril, and to be calm for that. Good boy. And then we can reward for him staying calm. So chin. Nice. Chin. Chin. Good boy. Chin. Chin. No. Chin. Good boy. Yes. And just baby steps. And I like to do this really regularly just to remind Chase. You can see sometimes he's already forgotten. So it's good to do this regularly so that when we come to the vets, it's no big deal. Chin. It's not paw. Chin. Chin. Just waiting for his weight to kind of drop. There we go. And I'm just going to put my finger near his nose. And it's just, there's no punishment if they don't do it, but we're just rewarding if they do let us do what. So I know he can do this. So I'm just going to wait for a chin. Chin. Yes. Good boy. And he did recently have his kennel cough, which is why he's a little bit more unsure of his nostrils. So I can make a mental note that I need to work on this some more. And this is why this session is also really important when you are kind of examining and checking over your dog like this. Just make a mental note for anything that where they maybe flinch slightly or wasn't fully relaxed or comfortable. And that could either be that maybe they are experiencing some pain or discomfort there, or maybe that is just somewhere that they're not fully comfortable or used to you touching. So either way, obviously, if you think it may be some kind of pain or discomfort, get it checked out by your vets. Or like with the nostril, I know for Chase, that's just something he's still not fully comfortable with. So I just need to make a mental note to work on that some more. So I'm not going to push that anymore for today. I'm going to try the teeth one as well, which I like to check. So again, similar, I put his hand on my chin and then I just like to lift up his gums. So as well as just checking for any kind of build-up or any issues with his teeth, we're also just checking that their gums are a nice colour, which would be different for every dog. So obviously just get used to what looks healthy for your dog. And you should, if you do this regular enough, you should notice if anything looks unusual, which is when we want to be taking them to the vets. I also in the checkup like to look at their paws. So I'm just going to rest his paw there. Just going to check between the toes and that all looks good. And like I say, we're not checking anything medically here. We are simply checking, so for two things. One, we're seeing if anything looks unusual or out of the norm, which is different for every dog, which is why you need to do this regularly enough so you get a good idea of what looks healthy and normal for your dog, and how they usually would react. So if they aren't fully comfortable with their paws, but then they suddenly go very uncomfortable, maybe there is some discomfort there. And we're also just desensitizing them to this so that if they do need to go to the vet or they do need to be checked properly, that they have less of an issue and it's less stressful experience for them. So we're going to check the other paw. Yeah. Good boy, waiting. Very good. I'm going to have him in a stand. Good boy. I'm just going to check his tail. And again, when I say check, I mean just gently lift and just make sure that he's super happy for me to do that. I know the vets also like to check his heartbeat. So again, I'm just in preparation for that. I'm just putting him in a stand. I'm just going to hold my hand on his chest. Good boy. And what I do like to do as well, which I would recommend, is I took home a pretend syringe. They kindly gave me a syringe to practice with Chase's kennel cough at home. Equally, if you have something like a cold metal spoon that you could use to practice checking their heartbeat, because that may give them a little fright or be uncomfortable if they're not used to having the cold metal on their chest. So we just need to think anything that may come up at the vets, let's just try and make that as stress-free as possible by practicing and rehearsing and having the dog fully comfortable with it in their own home and with you, so that the behaviour they're familiar with, even if it is with a stranger or someone that they're not used to performing that with them. So that is today's challenge for Ditch the Bowl Day 9. Use all of your dog's food bowl just to get to know their body a little bit more. Check their ears, their eyes, their nose, their mouth, their tail and their body. Just have a good feel around and make sure your dog's very comfortable. If you have any comments or questions, please leave them in the comments below, and thanks for watching.